Hello students, greeting from ISEC Learn, well known for better education and better careers. This is your instructor Dr. Raksha for the program of Masters of Public Health. I am an alumnus of GIM and have overall 10 years of experience in the field of healthcare and public health with topmost organizations of the South and North India. This course is all about 2 years where you will be having 4 semesters. In each semester you will be having different subjects. The main objective of the public health course is to prepare students as public health practitioners having the knowledge of the skills of the community diagnosis, ability to design policies, strategize, implement intervention programs, skills to develop public health policies, knowledge to evaluate the impact of the public health policies on the community health, and last but not the least, leadership skills in public health administration. Now we will see one by one the subjects. In first semester, the first subject would be Introduction to Public Health. Here students will learn the principle of the evidence-based public health and become familiar with the tools available for the implementation, including health communication, informatics, application of social and behavioral sciences, and health policies and law and ethics, which is very important. Then second subjects would be Introduction to Epidemiology. Here you will learn to determine the extent of disease, to study the progression of the disease, to evaluate preventive and therapeutic measures of a disease or condition, and to develop public health policies. Now, the third subject would be research methodology. Here you will learn every step of the research process, including how to collect data, build your argument, and develop your conclusion. Fourth subject would be communication, especially the health communication. We all know you will have to interact one-to-one with the patients, with the population, to make the awareness campaign, to make them aware about the diseases. So you will have to understand about model, ethical, responsible, professional behavior with the population, which will provide treatment to a diverse patient population which meets the standard of the care. Now, in second semester, you will having the health economics. Health economics aims to provide the information necessary to make rational choices. Students will learn here about how to develop funding for the healthcare and how to make the best possible use of the funds available for the population. Now the next subject is accounting, finance and procurement. Here students will learn to generate allocation and use of the financial resources in the health system. Globally, it has become very much important to recognize as an area of the major policy relevance to achieve universal health coverage. The next subject is Health Management Information System. The purpose of this course is to guide students to learn various health information required in the healthcare for smooth functioning, patient care, legal, research purposes in the public health area. In third semester, you will be having ecology and environmental health. Students, we all know our environment affects our health. The goal of this subject is to promote healthier environment to improve health. Importance of environment on the health and disease you will understand. Now the next subject is health policy and national health programs. We all are aware that government is running so many national health programs like tobacco, TB control program. You will be becoming the part of these national health programs. So you will have to learn how good health policy and national programs reduces the inequity and disparity based on caste, gender, disability, poverty, other forms of the social exclusion. This also includes offering financial protection to the poor and underprivileged patients. The policy aims to make health services and medicine affordable. The next subject is women and child health gender issues. Students, we all are aware about India's issues about the women and the child. We are facing so high maternal mortality rate, infant mortality rate, malnutrition. You will all have to work on these issues on ground level. The major objective of this course is to create an enabling environment for the empowering of the women to fight with the MMR, IMR, malnutrition and educational issues. Quality assurance and total quality management is another subject. In healthcare, quality is very important. Students will learn how to eliminate waste and increase efficiencies by assuring that the production process of the organization or the public health organization's product is done right in the first time. In fourth semester, you will be having subject management of the NGO. NGO is very important for the public health because this is the organization when disaster happens, they come and help a lot. Here students will understand the importance of NGO, how they fight against exploitation, injustice, corruption if found against any individual, class, community or the society. Here students have to learn to educate population for adoption of the good norms of the good citizenship. Now, last but not the least, legal issues in the healthcare delivery. Students, when you will be working on the ground level to remove the issues and diseases of the population, to work on the issues of the society, you will be facing so many legalities. So you have to learn about resolving and handling legal issues related to patient, population, importance of the consent and the paperwork before commencing any research project. At last, after finishing these modules, you will have to work on a real-time training or internship project report where you will be working on any government program like Anganwadi, malnutrition or anything you can choose and submit a project report to the institute before finishing this course. I hope this course will be fruitful for all of you and it will add value to your public health profession. I welcome all of you. Happy learning.